NCLEX RN Test Bank 800 Questions and Answers Newest Exam Review. Question 1. A male client with bipolar disorder is admitted. During assessment, what would the nurse expect to see? Option A, short polite responses. Option B, introspection. Option C, exaggerated self-importance. Option D, feelings of helplessness and hopelessness. The correct answer is option C, exaggerated self-importance. Grandiosity and an inflated sense of self-worth are characteristic of the manic phase of bipolar disorder. Question 2. A client with bipolar disorder taking lithium reports ringing in ears and blurred vision. What is the appropriate action? Option A, administer a stat dose of lithium. Option B, recognize this as an expected response. Option C, request an order for a stat blood lithium level. Option D, give an oral dose of lithium antidote. The correct answer is option C, request an order for a stat blood lithium level. The client is exhibiting symptoms of lithium toxicity which must be validated by laboratory studies immediately. Question 3. Which activity is most appropriate for a client with bipolar disorder during occupational therapy? Option A, playing cards. Option B, working crossword puzzles. Option C, playing tennis with a staff member. Option D, sewing beads on a leather belt. The correct answer is option C, playing tennis with a staff member. Playing tennis uses gross motor skills, eases tension, and helps expend excess energy in a controlled therapeutic environment. Question 4. A male client admitted for depression threatens to kill himself. What response by the nurse is most appropriate? Option A, I do not think you are worthless. Option B, do you not think this is a sign of your illness? Option C, I know with your wife and baby you have a lot to live for. Option D, you have been feeling sad and alone for some time now? The correct answer is option D, you have been feeling sad and alone for some time now? This response acknowledges the client's implied thoughts and feelings and encourages a response from the client. Question 5. Which of the following statements relevant to a suicidal client is correct? Option A, the more specific a client plan, the more likely the attempt. Option B, a first attempt means they will not try again. Option C, a threatening suicide is just seeking attention. Option D, nurses should not mention suicide to protect the ego. The correct answer is option A, the more specific a client plan, the more likely the attempt. A specific suicide plan is a high risk factor for a potential suicide attempt. Question 6. A suicidal client says, my life is so bad no one can do anything to help me. What is the most helpful initial response? Option A, it concerns me that you feel so badly. Option B, it will take a few weeks for you to feel better. Option C, you are telling me that you are feeling hopeless? Option D, let us play cards to get your mind off problems. The correct answer is option C, you are telling me that you are feeling hopeless? This response acknowledges the client's feelings and invites the client to continue discussing his perspective. Question 7. What is a long-term goal for a depressed suicidal client? Option A, provide a safe and structured environment. Option B, assist him to develop effective coping mechanisms. Option C, have him sign a no-suicide contract. Option D, isolate him from stressful situations. The correct answer is option B, assist him to develop effective coping mechanisms. Long-term therapy should be directed toward assisting the client to cope effectively with stress. Question 8. After treatment, a severely depressed client suddenly begins to feel better. The nurse knows there is an increased risk for Option A, suicide. Option B, exacerbation of depressive symptoms. Option C, violence toward others. Option D, psychotic behavior. The correct answer is option A, suicide. When a severely depressed client suddenly feels better, it often indicates they have made a decision to kill themselves and developed a plan. Question 9. Nursing care for the substance abuse client experiencing alcohol withdrawal delirium includes Option A, maintaining seizure precautions. Option B, restricting fluid intake. Option C, increasing sensory stimuli. Option D, applying ankle and wrist restraints. The correct answer is option A, maintaining seizure precautions. Clients experiencing alcohol withdrawal are at a high risk for seizures during the first week after cessation. Question 10. A psychotic client believes he is God and rules the universe. What type of delusion is this? Option A, somatic. Option B, grandiose. Option C, persecutory. Option D, nihilistic. The correct answer is option B, grandiose. Grandiose delusions are related to feelings of self-importance, uniqueness, and superiority. Question 11. A client tells the nurse he tasted poison in his evening meal. This is an example of what type of hallucination? Option A, auditory. Option B, gustatory. Option C, olfactory. Option D, visceral. The correct answer is option B, gustatory. Gustatory hallucinations involve sensory perceptions of taste. Question 12. A schizophrenic client believes her doctor is in love with her. Which defense mechanism is this? Option A, displacement. Option B, projection. Option C, reaction formation. Option D, suppression. The correct answer is option B, projection. Projection involves attributing one's own thoughts or feelings to another person. Question 13. What is the first organ that sustains irreversible damage after water submersion? Option A, kidney. Option B, brain. Option C, heart. Option D, lungs. The correct answer is option B, brain. The cerebral neurons sustain irreversible damage after 4 to 6 minutes of water submersion. Question 14. What is the most serious complication associated with bacterial meningitis known as Waterhouse-Friderichsen syndrome? Option A, peripheral circulatory collapse. Option B, a syndrome of inappropriate antidiuretic hormone. Option C, cerebral edema. Option D, auditory nerve damage. The correct answer is option A, peripheral circulatory collapse. Waterhouse-Friderichsen syndrome is peripheral circulatory collapse which may result in diffuse intravascular coagulation and death. Question 15. A child has an initial diagnosis of Lyme disease. What symptoms would be important to include in the history? Option A, decreased urinary output. Option B, fever of 103 degrees Fahrenheit. Option C, rashes on palms and soles. Option D, a headaches, malaise, or sore throat. The correct answer is option D, headaches, malaise, or sore throat. Classic symptoms of Lyme disease include headache, malaise, fatigue, stiff neck, and generalized lymphadenopathy. Question 16. What are the most commonly known vectors of Lyme disease? Option A, mites. Option B, fleas. Option C, ticks. Option D, mosquitoes. The correct answer is option C, ticks. Ticks are the primary vector responsible for the transmission of Lyme disease. Question 17. What is a laboratory technique specific for diagnosing Lyme disease? Option A, polymerase chain reaction. Option B, a heterophil antibody test. Option C, decreased serum calcium. Option D, increased serum potassium. The correct answer is option A, polymerase chain reaction. Polymerase chain reaction is the laboratory technique specific for diagnosing Lyme disease. Question 18. What treatment does the nurse expect for a child with Lyme disease? Option A, a complete bed rest. Option B, tetracycline treatment. Option C, intravenous amphotericin B. Option D, high-protein diet. The correct answer is option B, tetracycline treatment. Tetracycline is the treatment of choice for children with Lyme disease who are over the age of 9. Question 19. Which of the following would the nurse use to assess adequacy of fluid resuscitation in a burn child? Option A, blood pressure. Option B, serum potassium level. Option C, urine output. Option D, a pulse rate. The correct answer is option C, urine output. Urine output alteration in sensorium and capillary refill are the most reliable indicators for assessing adequacy of fluid resuscitation. Question 20. What is the proper positioning for a child in Bryant traction? Option A, hips flexed at 90 degrees with knees extended. Option B, legs extended with no hip flexion. Option C, affected leg extended with slight hip flexion. Option D, hips and knees at 90 degrees flexion. The correct answer is option A, hips flexed at 90 degrees with knees extended. In Bryant traction, the buttocks are slightly elevated off the bed and the hips are flexed at a 90-degree angle. Question 21. When assessing for vascular injury in a supracondylar fracture of the femur, what are the signs of ischemia? Option A, a bleeding, bruising, and hemorrhage. Option B, increased creatinine and liver enzymes. Option C, pain, pallor, pulselessness, paresthesia, and paralysis. Option D, a swelling, pain, and muscle rigidity. The correct answer is option C, pain, pallor, pulselessness, paresthesia, and paralysis. The 5 Ps of ischemia are pain, pallor, pulselessness, paresthesia, and paralysis. Question 22. What is the toxic effect of phenytoin therapy in children? Option A, Stevens-Johnson syndrome. Option B, folate deficiency. Option C, leukopenic aplastic anemia. Option D, agranulocytosis and nephroses. The correct answer is option A, Stevens-Johnson syndrome. Stevens-Johnson syndrome is a known toxic effect of phenytoin therapy. Question 23. In teaching parents about febrile seizures, the nurse states that option A, fever over 103 degrees is generally related. Option B, febrile seizures do not usually recur. Option C, there is little risk of neurological deficit as sequelae. Option D, febrile seizures are associated with disease of the central nervous system. The correct answer is option C, there is little risk of neurological deficit as sequelae. There is little risk of neurological deficit, mental retardation, or altered behavior secondary to febrile seizures. Question 24. What is the characteristic rash of chickenpox? Option A, a vesicular scabs in macular stage. Option B, a profuse on trunk and sparse on extremities. Option C, appears on neck and spreads downward. Option D, slapped cheek appearance. The correct answer is option B, profuse on trunk and sparse on extremities. A characteristic rash of chickenpox appears profusely on the trunk and sparsely on the extremities. Question 25. What is the priority nursing goal when working with an autistic child? Option A, establish trust. Option B, maintain communication with family. Option C, promote involvement in school activities. Option D, maintain nutritional requirements. The correct answer is option A, establish trust. Establishing a trusting relationship is the priority nursing goal when working with an autistic child. Question 26. A child receiving intravenous deferoxamine suffers hypotension and facial flushing. What is the initial intervention? Option A, discontinue the intravenous. Option B, stop medication and begin normal saline infusion. Option C, take vital signs and report to physician. Option D, assess urinary output. The correct answer is option B, stop medication and begin normal saline infusion. The child is exhibiting an allergic reaction, so the medication must be stopped and the intravenous line kept open with normal saline. Question 27. What should a nurse recommend for a 4-month-old with diarrhea to prevent dehydration? Option A, fruit juices. Option B, a diluted carbonated drinks. Option C, soy-based lactose-free formula. Option D, irregular formulas mixed with electrolyte solutions. The correct answer is option C, soy-based lactose-free formula. Soy-based lactose-free formula reduces stool output and the duration of diarrhea in most infants. Question 28. Which therapy results in increased myocardial work and oxygen demand? Option A, positive inotropic therapy. Option B, negative chronotropic therapy. Option C, balanced myocardial oxygen supply and demand. Option D, afterload reduction therapy. The correct answer is option A, positive inotropic therapy. Inotropic therapy increases contractility, which significantly increases the myocardial oxygen demand. Question 29. Which medication requires close observation for bronchospasm in a client with asthma? Option A, verapamil. Option B, Pomrinone. Option C, epinephrine. Option D, propranolol. The correct answer is option D, propranolol. Propranolol is a beta-blocking agent which can increase airway resistance and cause bronchospasms. Question 30. In coronary artery disease, bradycardia is often associated with occlusion of which artery? Option A, right coronary artery. Option B, left main coronary artery. Option C, circumflex coronary artery. Option D, left anterior descending coronary artery. The correct answer is option A, right coronary artery. The right coronary artery perfuses the sinoatrial and atrioventricular nodes in most individuals, leading to bradycardia if occluded. Question 31. What is the purpose of exercise electrocardiography in the diagnosis of cardiovascular disorders? Option A, provide a baseline for further tests. Option B, simulate usual daily activity. Option C, monitor heart toning. Option D, determine if the myocardium can meet increased oxygen demands. The correct answer is option D, determine if the myocardium can meet increased oxygen demands. Exercise stress testing evaluates the ability of the myocardium and coronary arteries to meet the increased oxygen demands of the heart. Question 32. A cardiac client exhibits disorientation, lethargy, and seizures. This may be a toxic reaction to option A, digoxin, option B, lidocaine, option C, quinidine gluconate, option D, nitroglycerin 4. The correct answer is option B, lidocaine. Side effects of lidocaine include heart block, dizziness, confusion, tremor, lethargy, and convulsions. Question 33. Which electrocardiogram change would be seen as a positive myocardial stress test response? Option A, hyperacute T wave. Option B, prolongation of PR interval. Option C, ST segment depression. Option D, pathological Q wave. The correct answer is option C, ST segment depression. Horizontal ST segment depression of greater than 1 mm during exercise is a positive criterion on the exercise stress test. Question 34. Which manifestations are seen in left-sided heart failure rather than right-sided? Option A, elevated central venous pressure. Option B, dyspnea and jaundice. Option C, hypotension and hepatomegaly. Option D, decreased peripheral perfusion and RALs. The correct answer is option D, decreased peripheral perfusion and RALs. Left-sided heart failure leads to left ventricular dysfunction, decreased cardiac output, pulmonary edema, and RALs. Question 35. What response should a client taking sublingual nitroglycerin expect? Option A, stinging or burning under the tongue. Option B, temporary blurring of vision. Option C, generalized urticaria. Option D, urinary frequency. The correct answer is option A, stinging or burning under the tongue. Stinging or burning under the tongue indicates that the medication is potent and effective. Question 36. What differentiates acute from chronic respiratory acidosis? Option A, increased PaCO2. Option B, decreased PaO2. Option C, increased HCO3. Option D, decreased base excess. The correct answer is option C, increased HCO3. Elevation of bicarbonate is a compensatory mechanism in acidosis that takes time to reach maximum compensation. Question 37. Hematotympanum and otorrhea are associated with which head injury? Option A, basilar skull fracture. Option B, subdural hematoma. Option C, epidural hematoma. Option D, a frontal lobe fracture. The correct answer is option A, basilar skull fracture. Basilar skull fractures involve the base of the skull and are the only type where blood or cerebrospinal fluid leakage occurs from the ear. Question 38. A client with a C3-C4 fracture arrives in the emergency room. What is the primary nursing intervention? Option A, stabilization of cervical spine. Option B, airway assessment and stabilization. Option C, confirmation of spinal cord injury. Option D, normalization of intravascular volume. The correct answer is option B, airway assessment and stabilization. The primary intervention in spinal cord injury is protection of the airway and ensuring adequate ventilation. Question 39. In a client with chest trauma, how can the mediastinal position be evaluated? Option A. Auscultating breath sounds. Option B. Palpating for crepitus. Option C. Palpating for tracheal deviation. Option D. Auscultating heart sounds. The correct answer is option C. Palpating for tracheal deviation. Mediastinal shift occurs with tension pneumothorax causing tracheal deviation and deviation of the heart point of maximum impulse. Question 40. Priapism may be a sign of? Option A. Altered neurological function. Option B. Imminent death. Option C. Urinary incontinence. Option D. Reproductive dysfunction. The correct answer is option A. Altered neurological function. Priapism in a trauma client is due to neurological dysfunction seen in spinal cord injury. Question 41. How do the symptoms of neurogenic shock differ from hypovolemic shock? Option A. In neurogenic shock, skin is warm and dry. Option B. In hypovolemic shock, there is bradycardia. Option C. In hypovolemic shock, capillary refill is less than 2 seconds. Option D. In neurogenic shock, there is delayed capillary refill. The correct answer is option A. In neurogenic shock, skin is warm and dry. Neurogenic shock causes vasodilation and bradycardia, resulting in warm, dry skin, whereas hypovolemic shock results in tachycardia and cool skin. Question 42. Which physiological effect decreases intracranial pressure? Option A. Increased core body temperature. Option B. Decreased serum osmolality. Option C. Administration of hypoosmolar fluids. Option D. Decreased PaCO2. The correct answer is option D. Decreased PaCO2. Carbon dioxide is the most potent vasodilator known. Decreasing it through hyperventilation reduces intracranial pressure. Question 43. A client with a basilar skull fracture has blood-tinged drainage from his nose. What is the next nursing intervention? Option A. Pass a nasogastric tube. Option B. Place gauze in nares to impede flow. Option C. Suction nasal drainage. Option D. Perform a halo test and glucose level test. The correct answer is option D. Perform a halo test and glucose level test. Testing the fluid from the nares will determine if the presence of cerebrospinal fluid is leaking due to a dural laceration. Question 44. A client with AC4 injury is at risk for autonomic dysreflexia. What symptoms should be reported? Option A. The dizziness and tachypnea. Option B. Circumoral pallor and lightheadedness. Option C. Headache and facial flushing. Option D. Pallor and itching of face. The correct answer is option C. Headache and facial flushing. Autonomic dysreflexia results in vasoconstriction and elevated blood pressure, presenting as headache and facial flushing.